seeing the partnership between Luma and NextGen and that whole closed loop patient experience, because really that's what we're aiming for, and that's what we feel we're getting from Luma. We've seen 3 results that have been pretty impactful. The number of filled appointment spots has definitely increased, or the reduction in missed opportunities, as well as a reduction in our did not keep appointment rate. That went from about 13% to about 9%, which is pretty significant when you think about it. And then we've seen an increase in our patient satisfaction scores since we rolled out with the different opportunities with Luma. Another one worth mentioning is the patient self-scheduling, that we can now direct a patient to our website where they can book an appointment at any time. It could be 11 o'clock at night and they decide they want an appointment, and Luma will offer them the next available appointment. And only because Luma and NextGen work so well together are all of those things really possible. We're just really starting to explore broadcast and what it can do for us. The latest thing that we decided to use it for, that again was labor intensive, is if a provider calls out sick, we have to call every single one of those patients and cancel their appointments and try to get a hold of them. So now we're leveraging broadcast for that. And so we can send out a text to all of those scheduled patients, letting them know that their provider is out sick. Would they like to reschedule, and then send them the link to self-reschedule that appointment. So that's going really well, and the department that we're trialing that in is super happy with how that's working. The exciting part for us that we've seen from Luma in terms of the patient, we started with canceling appointments or patient appointment reminders. And as we rolled that out, we began to see a decrease in our did not keep appointment rate, just because of the ease of allowing the patient to cancel if they needed to, versus having to call in, which can be cumbersome to get through. And then on the other side of the equation, what happened is it meant that our front office folks didn't have to do confirmation calls on all of those appointments that got confirmed via the app. And so Luma would confirm it right in NextGen, and we could see that they've already received that confirmation. Our new patient packet is like 17 pages. And on 17 pages, the patient has to write their name, their date of birth, the data, all of those things, where all of that will autofill. We worked with Luma to do our slide calculation for us. So once the patient fills out the slide form, one of the issues we find is that manual calculation, human error results, where the form will get calculated automatically. I think the biggest patient satisfier that we've seen so far is in the wait list opportunity, because patients would like a sooner appointment often. And so as we rolled the wait list out next, what that allowed them to do is to get offered an appointment. Say that person that we sent a confirmation to cancels their appointment, the system will automatically then send that appointment opportunity to somebody that's on a wait list to accept that appointment and gets them rescheduled, and so they get in sooner. And so that's been a really great way to provide patient satisfaction when it's hard to get in. to an appointment. And it's really because of that partnership between Luma and NextGen that we're able to leverage all of the self-scheduling, the wait list, the confirmation things that happen.